A third case of measles has now been confirmed here in Connecticut. This is the most we've seen in a single year since 2019. And it comes at a critical time this time, just as thousands of Connecticut children are heading back to school. The highly contagious virus can spread quickly, especially among people who are not vaccinated. Fox 61's Kayla Cade is breaking down what parents should know and how to protect their children.
This latest case involves someone who recently traveled outside the country. Health officials say the person returned to Connecticut and developed a high fever and a rash.
June is when health officials started to see cases of measles in Connecticut this year. The first case was confirmed on June 15th, where an unvaccinated adult in Hartford County contacted the highly contagious disease after traveling internationally. 2 weeks later, another case was confirmed. Health officials say this adult also lives in Hartford County and is vaccinated. It was reported they came in contact with someone in the state who was exposed with measles. On Monday, health officials said a third case was confirmed. It is unknown if they have been vaccinated or not. The Department of Public Health encourages everyone to get the measles, mumps, and rubella, or MMR vaccine. According to the Centers for Disease Control and Prevention, 9 out of 10 unvaccinated individuals who encounter an infected person will become infected with the measles virus. The CDC also says measles can be dangerous, especially for babies and children under the age of 5. So far, there are more than 1,300 measles cases throughout the country of those 19 years old and younger. The American Academy of Pediatrics says with vaccination rates declining, it could increase the risk of outbreaks in schools this fall. Just last week, an official from New Britain Public Schools said about 13 students didn't have the required vaccinations for the start of the school year. The city offered a clinic for last-minute shots amid community health concerns. Last week, an official from New Britain Public Schools said about 300 students didn't have the required vaccinations. Students in preschool to 12th grade in Connecticut are required to have multiple vaccines before they start school, including the MMR vaccine.
There are some measles symptoms you can look out for, such as fever, cough, red watery eyes, and rash. These symptoms can appear 7 to 14 days after being infected. And if you think you have measles, go see your doctor or call them to find out how you can safely manage symptoms at home. In studio, Kayla Cade, Fox 61.